Okay, my IQ may be somewhat equal to the optimal storage temperature of wine, but I'm definitely picking up on some kind of theme here. We started with the serotonin and norepinephrine reuptake inhibitors, great for depression and anxiety states. Then we continued on to the tricyclic antidepressants, which also exert both serotonin and norepinephrine reuptake inhibition, though our main focus there was treating neuropathic pain. And now we're continuing the chapter with monoamine oxidase inhibitors, or MAO inhibitors. Monoamines, of course, include norepinephrine and serotonin, so again, we're going to be increasing the noradrenergic and serotonergic transmission both in the periphery and in the CNS. This time, though, we'll also be enhancing the activity of another monoamine, dopamine, and that means we'll be treating Parkinson's. But that's about it, really, because MAO inhibitors just really aren't used anymore in clinical practice. One of the first classes of antidepressants introduced in the 1950s, MAO inhibitors were historically used for depression and anxiety, but fell out of use due to toxicity and lethal food and drug interactions. They're now primarily used to treat depression unresponsive to other medications. Think of it this way, MAO inhibitors are kind of like Nicolas Cage. Born in the middle of the last century, useful for a while, even winning an Academy Award, mind you, but then slowly falling out of favor and now only used as a last resort by casting directors when other actors are unresponsive. MAO inhibitors act by blocking the activity of monoamine oxidase, thus preventing the breakdown of monoamine neurotransmitters and increasing their availability. There are two isoforms of monoamine oxidase, MAO-A and MAO-B. In this sketch, MAO will be represented by a mouse. MAO-A, then, is an albino mouse. MAO-A preferentially deaminates serotonin, norepinephrine, and dopamine. I'm sorry, but that is the cutest MAO I've ever seen. Hey there, my eyes may be sickly and red, but that doesn't mean they can't move you to tears. Anyway, as he takes tiny nibbles from that cheese wheel, let it remind you that MAO-A is responsible for catalyzing the oxidative deamination of amines such as dopamine, norepinephrine, and serotonin, thereby decreasing monoamine content in peripheral and CNS neurons. Let me show you what I mean. This little albino MAO here has decided to enjoy the assertive, earthy, and complex flavor of a beautifully aged Gruyere. That smiley face, of course, is our recurring sketchy symbol for serotonin. His friend has decided to partake of the rich, buttery interior and white, bloomy rind of an exquisite camembert. In this sketch, though, let that north compass remind you of norepinephrine. And in the back, our last albino MAO is a bit shy, but that doesn't mean he's not enjoying the delicate texture and chewy tannins of that dopamine rope. So, while MAO-A breaks down serotonin, norepinephrine, and dopamine, MAO-B just kind of focuses on metabolizing that dopamine. And instead of an albino mouse, MAO-B will be represented by a black mouse. Maybe you can spot that cute little black MAO now, lurking high in the shadows, helping out with the metabolism of that dopamine rope. God, he's just so cute. You see him up there? He's all like, hey there, I know it's hard to see me up here lurking like a cute little golem, but I can see you. All right, if MAO enzymes are mice, MAO inhibitors are mouse traps naturally. They act by blocking the degradation of monoamines, thereby increasing noradrenergic, serotonergic, and dopaminergic transmission in the periphery and the CNS. Most MAO inhibitors available in the US are non-selective and irreversible. So, kind of like this mousetrap, it doesn't care if you're an albino mouse or a black mouse. All are welcome to this enticing bit of cheese. Any takers? Anyone down to try on a tight-fitting little mouse-sized metal turtleneck? And then, wham! It's irreversible. Ugh. It's still pretty cute, though. Let's quickly go over the names of the MAO inhibitors so that you can recognize them on the exam. There's tranylcypromine, embodied by this sign inviting you to try a sip of wine. Don't mind if I do. And then there's phenelzine, represented by this funnel sitting atop the wine bottle. Okay, I like it. And lastly, there's isocarboxazid, represented by this boxed wine. And don't let that tacky, cheap-looking packaging fool you. I mean, this is France. That, my friend, is still some premium quality Dionysus juice in there. full-bodied with overtones of oak and plastic? Needless to say, Chateau Tyramine is not your typical winery. Because both TCAs and MAO inhibitors are potentially lethal in overdose, require careful titration, have serious drug interactions, and have many adverse effects, their clinical use is limited. MAO inhibitors increase the availability of serotonin and norepinephrine in the CNS, which is useful when treating depression. At Sketchy, whenever we talk about the treatment of depression, we'll include a symbol like this one, the SAD mask to remind you of the negative symptoms associated with major depressive disorder, and the happy mask to emphasize the goal of treatment, which is the remission of all symptoms. Just like with TCAs and Nicolas Cage though, MAO inhibitors are now relegated to second or third line treatment for major depressive disorder. Though they have been reported to be particularly useful for treating atypical depression, which includes certain features such as hyperphagia and hypersomnia and leaden paralysis, though the utility of diagnosing major depression with atypical features has been called into question. Yeah, MAO inhibitors are now reserved for patients whose anxiety or depression has been unresponsive to other agents. At Sketchy, whenever we want to convey treatment-resistant depression specifically, we'll include a guy like this one here, struggling with a resistant bottle of 1949 Chateau Tyramine Chardonnay. That's probably vinegar by now. I wouldn't even bother. All right, before we talk side effects, I want to briefly discuss one other MAO inhibitor, selegiline, a selectively irreversible inhibitor of monoamine oxidase B, and in this scene, a sledgehammer. Recall that MAO-A, embodied by those albino mice, metabolizes norepinephrine, serotonin, and dopamine, while MAO-B metabolizes dopamine selectively. Well, Peter Gabriel over here has had enough of this ridiculously cute infestation, and is evoking some selective and irreversible inhibition of MAO-B. Come on, Peter. Just look at those beady little eyes. What have you become? Selegiline then inhibits the breakdown of dopamine, and this is especially useful in the CNS, hence the fancy, appetizingly cerebral-looking meat that's hanging up there to dry. Also, take a look at the wall behind him, and you'll notice that we've incorporated a kind of cogwheel design into that wall clock. It's our recurring Sketchy symbol for the cogwheel rigidity of Parkinson's. The motor features of Parkinsonism are treated with levodopa and other dopamine agonists that restore central dopaminergic transmission. And a selective MAO-B inhibitor like selegiline can be used as adjunctive therapy for patients with declining or fluctuating responses to levodopa. Alright, I've already mentioned that MAO inhibitors are not first or second line antidepressant medications because of their relatively extensive side effect profile. And because they inhibit the breakdown of serotonin, you'd expect them to have some of the same side effects as those caused by the SSRIs, right? And they do. In fact, the most common adverse effects of MAO inhibitors are orthostatic hypotension, weight gain, and these agents are associated with the highest rates of sexual side effects of all the antidepressants. In this sketch, however, I want to highlight a few serious side effects associated with the MAO inhibitors that you'll likely see on the exam. Take a look at this table over here, set with some wine, some fancy cheeses, you've got your cured meats hanging in the corner. You know, you can climb the Eiffel Tower or take a stroll down Les Champs-Élysées. But if you haven't gone down into the dark, dank bowels of some mouse-infested French wine cellar and enjoyed a slightly overaged bottle of Chateau Tyramine, I mean, you haven't lived, mon frère. Oh, that subtle aftertaste you're sensing? That's tyramine. Tyramine is a naturally occurring monoamine compound found in aged meats, alcoholic beverages, and fermented dairy products like this cheese here. Tyramine acts as a catecholamine-releasing agent in the body, but before it gets to the general circulation, it's metabolized in the gastrointestinal tract by MAO-A. This is depicted by our albino mouse friend here, chowing down on that tyramine-ridden, gastrointestinal-evoking feast in front of him. But if you inhibit MAO-A, though, all that tyramine gets to flow into the general circulation where it acts as a sympathomimetic agent, displacing norepinephrine from neuronal storage vesicles. Just think of this albino mouse here getting snapped in the tail by that MAO inhibitor, sending an absurd amount of norepinephrine cheeses out into the synapse. This can precipitate a pressor response consisting of vasoconstriction, tachycardia, and hypertension. Not only that, patients on an MAO inhibitor who ingest large amounts of dietary tyramine may experience malignant hypertension leading to stroke or MI. Therefore, these patients must adhere to a low tyramine diet. And lastly, just like with other serotonergic drugs such as SSRIs, SNRIs, and TCAs, MAO inhibitors are associated with serotonin syndrome, a potentially fatal syndrome caused by excessive levels of synaptic serotonin. It presents with autonomic instability, agitation and hyperthermia, and hypertension. And remember to look for hyperreflexia and clonus as well. We've even included a little wooden tricyclic tricycle to remind you of the dangers associated with concurrent use of multiple drugs that increase CNS serotonergic transmission, such as MAO inhibitors with tricyclics or SSRIs. Keep in mind that most serotonergic antidepressants should be discontinued at least 2 weeks before starting an MAO inhibitor. Check out our SSRI sitcom for more info. Alright, it's about that time. Let's sum up this sketch. Monoamine oxidase A, the albino mouse, is responsible for the degradation of serotonin, norepinephrine, and dopamine in the periphery and CNS. MAO-B, the black mouse, works selectively on dopamine. Remember that selegiline selectively inhibits MAO-B, which is especially useful for increasing dopamine levels in Parkinson's patients. The non-selective MAO inhibitors include tranylcypromine, try a sip of wine, the phenelzine funnel, and the isocarboxazid boxed wine. All of these MAO inhibitors are irreversible, so once that trap comes down, Chateau Tyramine is not your typical winery because MAO inhibitors are really only used to treat atypical or treatment-resistant depression. Never co-administer MAO inhibitors with SSRIs, SNRIs, or TCAs. You can precipitate a potentially fatal serotonin syndrome. And watch out for those tyramine-containing foods. MAO inhibitors can precipitate a hypertensive crisis. What? What phantom? You mean the phentolamine phantom, the infamous alpha blocker that haunts the opera house above? Ha ha ha! Don't be a foolish mink. He hasn't been seen for years. All I really remember is that phentolamine is an alpha-1 and alpha-2 blocker that's useful for managing the hypertensive symptoms related to tyramine toxicity. Nope, I really don't see him. So yeah, that's the end of the sketch. À toutes les... You know, I just want to point out, they didn't ask if I spoke French before they put all this French in here. The phantom of the alpha is there, inside your mind.